Wayne County is now the latest in our area to declare a state of emergency, the third county to do so. And we are told mandates are possible. It's due to a record high number of hospitalizations and one of the highest positivity rates in New York State. As 13 WHAM's Tyler Brown reports, several counties in our region are seeing similar trends. Tyler?
That's right, Jenny. Several county health officials from across the Finger Lakes region tell me they are very concerned about this, as the Finger Lakes region is home to now 4 of the top 6 largest county positivity rates in the state. Out of the 9 counties that make up the Finger Lakes region, these 4, Orleans, Wyoming, Genesee, and Wayne County, are among the highest infection rates in the whole state, all surpassing 13% average per week. Wayne County's health commissioner says for them, COVID hospitalizations and infection rates are at an all-time high, prompting a state of emergency.
We're very concerned because the numbers are just getting higher, and we just recently had Thanksgiving, so we expect this week to even have more high numbers.
In Wayne County, 766 people are currently in isolation, and 51 others are in the ICU battling COVID.
We got 94 individuals have passed, unfortunately, in our county, and we have seen more than 25% of that has happened since the beginning of November.
Health officials stress that at-home spread and unvaccinated residents are big reasons for the surge. Ontario County's health commissioner Mary Beer says even though her county's infection rate isn't as high as others in the region, she is seeing similar difficulties as many rural regions of convincing unvaccinated individuals to get their shot.
We've hit the wall, if you will, of who wants to get vaccinated. And we're just seeing that people are not as cooperative as they used to be. They're more evasive. They just don't care.
Wayne County officials say mandates are now possible as part of their state of emergency, but they are hoping it won't come to that.
So it's not a game to follow, and it's just something that people need to pull their bootstraps up again and start, looking at doing some protective measures as they did previously.
And Wayne County's health commissioner told me today their county-run nursing home is getting 6 National Guard members to help with staffing shortages. Ontario County says it's also hoping for that same help as well from the National Guard. Jenny?
Another new increase in COVID hospitalizations today, now just shy of 500. Daily increases stretching facilities, healthcare workers, and now impacting people with other medical needs. Some 30 hospitals across the state are now part of New York's order for hospitals with limited capacity to pause some elective procedures. 13 WHAM's Carla Rogner checked in with some area hospitals as they deal with this latest COVID hurdle. Carla?
Ginny, an executive order from Governor Hochul allows the Department of Health to limit non-essential and non-urgent procedures to make room for more critically ill patients. Leaders at Finger Lakes Health and Thompson Health say they have been inundated with so many COVID patients. Many of these procedures have already been on the back burner for months.
We right now have 3 ICU boarders in our ED. We've got 11 other patients waiting for beds, and there's 47 patients in a department that was built for 24. This is what we're dealing with on a daily basis.
Thompson Health President and CEO Michael Stapleton describes desperate conditions inside his hospital.
It's just becoming a perfect storm with the decreases in staffing that we've all experienced over the last 20 months and the increase in COVID cases and the inability to move nursing home patients out.
Thompson Health has had to pause elective procedures for 2 months to free up hospital beds.
I'm concerned about the lack of preventive medicine that's being done. I'm concerned about, people not doing their colonoscopies, not doing their endoscopies, not getting their mammogram.
Geneva General Hospital is also stopping elective procedures. Dr. Jason Feinberg says they had to stop overnight elective procedures weeks ago.
It's only elective for so long, right? And then something really has to be done.
His hospital is now seeing more COVID patients than ever, most of them unvaccinated.
We've had as high as 18 boarders in the emergency room recently, meaning patients that were admitted to the hospital that did not have beds, and having 18 of those in a 22-bed ER is pretty dramatic.
Geneva and Thompson are 2 of about 30 hospitals in New York with less than 10% capacity, having to stop elective procedures until the hospitals can catch up.
And so there'll be a high demand and there'll be a high volume period. And we certainly want to do those cases when it's safe to do so.
Hospital leaders agree the key out of this crisis is to get more people vaccinated and open up more nursing home beds. They are asking people to do anything they can to help out these healthcare professionals by getting vaccines, boosters, and even flu shots. Jenny?
Advocacy group. It follows what's been a record year for violence. As Chase Howell reports, the leader of that group says people and elected leaders need to step up. Chase?
Yeah, an event to help those in need of Christmas cheer turned into a moment of chaos. A man and his girlfriend were headed to get a Christmas tree at La Marqueta on Friday when things turned violent. And now a local advocacy group is speaking out.
Because if anybody gives a damn, we do.
A call for action after a man was shot Friday afternoon across from a Christmas tree giveaway on North Clinton Avenue and steps away from the Father Tracy Advocacy Center.
How can you place millions of dollars in here, around here with new houses, this plaza, giving away trees, and someone is shot right here?
Rudy Rivera, the CEO of the center, sees the escalating gun violence and is frustrated with city leaders and the community. He wants a greater police presence on the streets of North Clinton.
I do not see police officers here unless it's an event. But other than that, you don't see them. So what are the residents to do?
RPT Captain Brian Marone understands the frustration and says the department is trying to stop these violent crimes, but staffing is an issue.
We have our officers each day responding to the 911 calls, and then when we have the ability and have enough people, we will supply additional resources to those areas like North Clinton Avenue where we've had continued problems.
Rivera says it's also up to the people who live in the North Clinton neighborhood to take responsibility.
This is a failure of the rest of y'all for not dealing with this matter in the way that you need to, which is to take ownership for our own conditions in our own communities.
And he says he's tired of hearing the same old answers from city leaders about this long-standing issue.
Wake up. For what you're doing is not working. It simply is not working.
RPD says they have no suspects in custody in Friday's shooting, and I can confirm the individual who was shot last Friday is expected to make a full recovery.